in this particular clinical trial, we looked at the dosing regimen that would be appropriate to take this phase 1 of the trial into the next stage. And we wanted to see if treatment of diabetic macular edema that's clinically significant with OCS-01 eye drops 6 times a day, and following that up with treatment 3 times a day after doing that for the first 6 weeks, would first of all have a vision benefit compared to no treatment or sham, and whether that treatment benefit at 6 weeks would be sustained through 12 weeks. That was the primary endpoint, was 6 weeks, visual acuity improvement at 6 weeks. The secondary endpoints that we looked at were central macular thickness at week 6 and 12, as well as visual acuity improvement at week 12. And of course, just like with any other trial, we looked at the AEs carefully with this particular treatment. So in terms of results, the improvement in visual acuity was clinically significant with 7 letters gained at week 6, and this was sustained through week 12. Central macular thickness actually decreased significantly at week 2, and that decrease was maintained through week 12. And again, week 12 results were consistent, meaning that the improvement that was seen after the first initial loading dose phase was maintained with 3 times a day of eye drops. In terms of adverse events, there's no unexpected AEs or adverse events, and certainly no SAEs or serious adverse events that were thought to be due to the eye drops. In terms of increase in intraocular pressure, there was a small rise in intraocular pressure with a median rise of just above 2. And very few people had, about 14% of people had an increase of intraocular pressure of 10, and only 1% at any time point, and only 1% had an intraocular pressure of 35. It's nice to have an eye drop that's a non-invasive way of treating patients with diabetic macular edema, and even if it's not for every patient, you know, there will certainly be a subset of patients that will benefit from these treatments. And, you know, it may very well be the first line of therapy for diabetic macular edema. At the end of the next stage of the trial, we'll see what the results show us.